Welcome to Montgomery Smashing the Stigma, a podcast that shares stories about mental health and wellness and connects people with groups and solutions to help smash the stigma about getting help.
Hi, everyone. I'm Connie Gaylor, and you're listening to the Smashing the Stigma podcast. Joining me today are Beth Roach with Mental Health America of Northern Kentucky and Southwest Ohio, and Montgomery police officers James Martin and Rasheed Kassem. Rasheed is also part of the city's mental health team. Thank you, everyone, for joining me today as we talk about crisis intervention training in the law enforcement community and how that relates to mental health. Beth, could you tell us more about Mental Health America, what you do there, and how you interact with the law enforcement community?
Sure. At Mental Health America, Northern Kentucky and Southwest Ohio, we offer a lot of different services. The three arms of our organization are education, safety net, and advocacy. Some of the examples of what we do are pro bono counseling, payee services, harm reduction efforts, and direct services in the Pier, which is in Northern Kentucky, Covington. I'm part of the education efforts, and my role is the Crisis Intervention Team Program Director. I'm the CIT coordinator for Hamilton County, and I've been in this role for almost 2.5 years after retiring from 27 years as a police officer. With CIT, we do a lot of training. We provide free crisis intervention training for police officers, probation and parole officers, corrections, emergency communication professionals, and behavioral health professionals. And the goal is to have everyone in Hamilton County receive the same information and access to resources. Just an example, like our 40-hour training for first responders includes introductions to mental health, SUD, and co-occurring disorders. And we also have a presenter from Hamilton County DDS who talks about intellectual and developmental disabilities. We cover de-escalation, active listening, and other skills. Many of the blocks are taught by those with a law enforcement background. A little bit more about the training. The officers spend Wednesday morning in the community shadowing. They have opportunities to spend the morning with case managers, homeless outreach, visiting the jail mental health unit, spending time with the Recovery Center of Hamilton County or the Queen City Clubhouse, or going to PES or another mental health facility. And finally, on the last day of training, the officers do role play and practice skills they've learned throughout the week. We also have a resource fair. This is something that we instituted within the last year or so. And our community partners and social service agencies have tables. And it gives the officers an opportunity to ask questions and make personal connections with someone at those agencies. So it's not just a card or phone number, but a face. Most importantly, a lot of people think CIT stands for Crisis Intervention Training, and it's really about the team. We work to build bridges between the officers and social services, and we're an integral part of the mental health system in Hamilton County and often work on projects with the Hamilton County Mental Health and Recovery Services Board. One of the things I'm really proud of is we created a QR card with a list of CIT partners, and that's been distributed to every department in Hamilton County. One of the ways that we interact with officers is the CIT specialist team. Our goal is to have representation from every department in Hamilton County, and that includes probation, parole, corrections, and emergency communicators. Those meetings, we have presenters like Mobile Crisis Team, Lighthouse Youth Services, Pat's been out, and we meet to discuss updates, current case law regarding mental health, and troubleshoot issues different departments might be having. Finally, I just like to say I work with other county coordinators around Ohio, and I have to say that we're doing great things here, that Hamilton County is rich with resources and has a very collaborative and robust mental health system. And we truly value all of our partners in law enforcement and the social services and feel fortunate to be a part of all of those successes.
Man, that's a lot. And I don't think I realized, I think Rasheed had shared at one point kind of that it is an in-depth training. I guess I didn't realize how many hours.
Yeah.
It's a week long.
And I love that you have, it sounds like similar to our mental health fair, where you have everybody come together with tables and you can kind of travel around the room and talk to people. I know that we've appreciated this side of having you guys even at our own mental health fair, because I think it's something for the residents to see clinicians sitting around the fair, but to see our law enforcement and community like that there, then they see that it does take like a county effort to really make a difference. How many, because you're talking about all these people that you work with, to trying to get representation from all of the different jurisdictions. How many are there in Hamilton County that you're really working with?
Well, Hamilton County is kind of funny like that. So, you have Cincinnati and then the Hamilton County Sheriff's Office are some of the larger departments, but then there's 40 odd departments in Hamilton County.
Almost 50.
Yeah. Different little departments. And then we also work with University of Cincinnati Police Department, the colleges.
So that's a lot of officers.
Yeah. So it's
and other people that are taking this training.
Yeah.
So that's pretty widespread. And when you think about the success that you're having with really educating people and training people on knowing how to handle things with themselves and with the people that they come in contact with, crisis runs, you really have a wide reach.
Yes,
that's got to feel good.
It does. It does.
That's amazing to me. I just think that's awesome. So to my fellow employee officers here, James and Rasheed, you guys have been really involved in CIT training because, one, you went through it, like our officers are required to do. But then you've both, in one way or the other, been involved in presentations, whether it's to the community, to our staff, or at CIT training. So I'm going to kind of go back and kind of get your experience on it. So James, do you want to start and let us know?
Yeah, I loved CIT training. What it did is it gave me answers to questions I had that, people would ask me on the street, like, hey, my son's going through this, or my daughter's going through this issue, this mental health issue. Like, how can we get treatment? And I didn't have a good answer for them. I would be like, well, I could call mobile crisis, or I could take her down to UC if she's, threatening herself or others. But that's not the majority of the people struggling with mental health. That's just a small fraction that we deal with. So there's all this hurting people out here in our community that I didn't have answers when they said, what groups can I connect with? What social services are available? And I love what Beth said about building bridges, because that's really what it did. It gave me these bridges, like with people and groups that are out there that I didn't know about. And so it really helped me. And one of the most eye-opening parts of CIT training was going into the field and doing a study. I went to a school, behavioral school in Cincinnati, and it was so eye-opening. I was like, I can't believe what all these kids, all this trauma these kids are dealing with. No wonder they have mental health issues. They're hurting. They've seen so much violence. And one kid asked me, I did a little presentation. He asked me, like, have you ever been shot? And I'm like, no, I haven't. I've come close a couple times. And he lifted up his leg and showed me where he got shot at Fountain Square. And I was like, wow, okay. And, it opened my eyes to the problem, all this trauma these kids were dealing with. And I was like, no wonder they have trouble sitting still in class. There's so much violence has happened to them and around them. I would have issues, trying to cope with that. So it really opened my eyes. And that's probably the best part of CIT training for me, was just seeing how many people are hurting, and then all the different social services and connecting those hurting people to those services. But the other thing I love doing is being in the community, talking to community groups, sharing that information, going to the mental health fair, connecting with other people in the industry there. And again, just continuing to build those bridges.
I agree with all that.
Well said.
What he said.
I would say, so I started my career working down at the jail, and I worked in the psych unit for about 5.5 years. So I had a very narrow look into the mental health world from a criminal justice standpoint. And it was kind of like the more severe issues. And then I got out to patrol, and it was not as severe. You had some severe cases that you dealt with when you're dealing with somebody with like a critical incident response. But it was more of the things like you mentioned, where you didn't know how to help people. That the severe cases, you kind of know what to do with those. Mm-hmm. It's the ones where it's like, could be 3 a.m, or it could be a Sunday, or it could be this person doesn't know who to call, simply just getting therapy or getting medication or whatever it is. And when I went through CIT, I think it was back in 2011 or 12, and it was we rode with somebody that didn't know how to get to their doctor's appointment, or they couldn't get medications. Went to a behavioral health clinic and just saw the intake process, kind of like behind the scenes stuff. There was other therapists and doctors and social workers that it kind of just opened your eyes on all the stuff that you guys put together at CIT and coordinate people to be in that training. So the officers could see what all goes involved in somebody's life outside of them showing up to them having a severe issue, because it's everything else before that you can kind of intervene with or trying to get them the help. So I think the CIT training, the program is awesome. I currently do some presentation with the peer support stuff I think we'll talk about later. But just every aspect that an officer can get help with from all the resources they bring together. It's just a great program.
Well, talking about just how you've learned so much, through CIT and about how to approach people. I think back to a community mental health session that we did early on when we first started doing our community health, mental health presentations. And it wasn't on suicide. I think it was on anxiety and depression or something of that nature. And we had a husband and wife there that actually got up and said how appreciative they were to the Montgomery police because they had an adult daughter who still lived with them and who has some serious mental health issues that has prompted several calls to the police department. And they were just so appreciative that you guys don't come with sirens going and lights going, which would only amplify her crisis at the time, but instead approach it in a calm manner, which creates a more successful, response to her and what her needs are at the time.
Yeah.
And that really resonated with us that was there because, I'm sure we deal with those kind of response calls now differently than we did 10 years ago, 15 years ago, Beth.
Yeah,
I mean,
absolutely. Yeah, it's changed a lot in my career and with you guys too.
Yeah.
Because when you had a mental health crisis call 15 years ago, what were what did you have, the resources? What did you have that you could offer compared to what you know now or can do now? What was the typical response?
I'll start with that one. When I worked out west, when I started with the sheriff's office on patrol, and it was people out there, especially in the rural areas, don't have or know about the resources, just because they're kind of like living their own little bubble, I guess. But it was more, my only interaction was when somebody's in that severe mode and they have to go to like psych emergency service. So they have to go to the hospital, and then we put a 72-hour hold on somebody. So they have to be seen by the doctor. That was about my experience. Otherwise it was like call a family member or call the squad. Mm-hmm. That was about the extent of my, if you want to call it, crisis intervention response. And then because CIT is a mandated training that all officers have to go through, I'm glad it's mandatory because it opened my eyes on. So I had so many questions, took everybody's card and pamphlets and everything through all that, and being able to know who to call. We have mobile crisis and all that. That's all developed too. So it's like it's definitely developed, and it's great.
Yeah, I think I would echo Rasheed. 20 years ago when I started here, it was if they're an extreme case, yes, we'll get them to UC, get them evaluated by a doctor. If it didn't meet those threshold criteria, then we'd be like, call their psychiatrist, psychologist. But there's not a whole lot I can do here. I'm going to clear the call and go available, and that's
hope for the best.
Yeah.
And hopefully don't get called back.
Yeah, hopefully don't get called back. But a lot of times you did, and then you just wade back into the same broken situation, whatever the problem was. And it would soak up so much more time and resources. I think the big flip now is, hey, let's try to offer as many services. Let's try to identify the problem and then come up with a resolution so we don't come back here. And yeah, if they meet the threshold, we could take them to UC. But if they're already seeing a doctor at Lindner Center for continuity of care, why don't I follow behind you and I'll drive you up there or, escort you up there so you can have continuity of care. We're not introducing you to a new system. You can stay at Lindner Center or some other place.
Yeah.
And that's been championed here by, staff, by our supervisors, because it's what's best for the community. And that's what we're trying to do here, to fix the problem.
Well, so I guess, do you feel like now people are more comfortable calling in 911 when they have a crisis like that. I mean, I kind of think just with the stigma around mental health in general, which is, I think, really getting better now.
Yeah.
But 10 years ago, even, it probably was, don't you call 911. We don't want anybody knowing that this is going on at our house. But I feel like with the training that officers are being provided, that maybe people aren't as afraid to reach out and ask for help. Do you think that's the case? I mean, James, you just sound, and Beth too, all three of you, like you are so much more empathetic and prepared to when you respond to a call, that you're not going in like, well, I'm just going to restrain them and take them to UC. You're there to de-escalate. Like you said, you're taught all these de-escalation skills. Do you feel like people are more comfortable and not afraid to reach out for help now?
I think part of the nice thing too is that we have so many more options at this point with 988. The option of calling 988. You spoke of mobile crisis, Rasheed, and they had big expansion about almost 2 years ago now, where they got a grant and they were able to expand. They're almost 24 hours now. They're on communications in Cincinnati and Hamilton County. So there's a lot more accessibility for mobile crisis, for co-response. And then, like I said, using 988 as an alternative to 911. Yeah. So I think we've been given more tools over the years as well.
Yeah, for sure.
And I know the city contracted with Care Solace. And so I think we tried to get all the officers like a card that has a QR code to where that's something they can pass along to help those people with the resources. But I think it's smart that if you ask if there is, some kind of care already established, that you help them to get back in touch with that, which is very smart because that's where they're comfortable, right?
Mm-hmm. Yeah, we don't want to start over from the beginning. If they've already built a relationship with a therapist or with a organization, then let's try to keep them plugged in there. And now, if they, like I said, if it reaches that threshold where, okay, now they're a threat to themselves or other, and we have to take them downtown, we'll still do that. Yeah. But at the end of the day, we want to get them the help that they need. Yeah. So that's our goal, and we're all on the same team. And like I said, the old days of trying to clear the call as quickly as possible is over for us. And a lot of time, you asked about the stigma. I think there is some positive that's happened. Like I've had parents call us, or family members call us and tell us about a situation before the crisis, and give you a kind of a heads up, like, and they'll tell you like this is what we've tried, and they'll kind of reach out and already develop that rapport. Yeah. And they've done that a few times recently, and it's like, okay, that helps. So when we get the call there, we're going into somewhat of a known situation, and we're just that far ahead, when we go to implement strategies to improve the situation.
Yeah. Well, I think that says a lot if you have a community member that is confident enough in their local police department or sheriff's department to feel like I can share this and know that, that's going to help my situation, and that you would be receptive to it. Right. And maybe in the past that wasn't always the case, but you guys have worked very hard to get that message out there, and that speaks volumes to where we are, because the mental health, has gotten worse, especially since COVID. And we know that. And I'm just speaking like I know what I'm talking about. You're the ones who deal with it, So I think that all of your efforts, are being seen now, So we've kind of talked about how the community is seeing all of your hard work and the support that they're getting. I'd like to kind of talk now and kind of pivot to peer support. And when I say peer support, it's support within the departments, within law enforcement, and how you deal with all the things that you see. And although Montgomery may not be the same environment as Cincinnati or as another department, you still have enough. You still see things, and after a long career, like, some of you have had even more, and how times have changed, I'm sure that there's a lot there. So I know that that Rasheed and James are in peer support. You're Rasheed's certified peer support specialist. Did I get that right?
Peer support team member on a peer team.
Right.
I've kept my amateur status.
That's okay. And Beth, now, do you guys? So with your affiliation with that, how's the peer support? How are you involved in that?
I would just say, especially with efforts like Rasheed, who leads the Hamilton County Police Association peer support team wellness, that it's really changed a lot. I think when we came up, the mindset of officers was, suck it up, rub some dirt on it. There wasn't a whole lot of empathy there. And I think that's changing largely the efforts that you've made. That some of that, there's probably still some stigma and some mindset change that needs to happen, but it's improving. I think the younger generation is more open to some of that change too. And I know from a CIT perspective, we do include self-care, and we talk about post-traumatic stress, self-care. Rasheed and some of his counterparts come to the training and talk about wellness and peer support. And I just know from some of the speakers who've come, maybe that have a professional background. We have like Dr. Chard from the UC Stress Center, and we've had Allison Feening, who's with Pinpoint Behavioral. And they've said that as a result of the CIT training, that they've had officers reach out following that training to engage services. So that makes my heart really happy.
Yeah. It makes me feel good too.
So I think that's from a CIT perspective, that's our win.
That's good.
Yeah,
what does the training to become a peer support specialist involve for somebody who's like you've went through that? So what did that involve?
So I would say, because I work with all the coordinators, Hamilton County does a really good job we have a lot of different peer teams. I know Cincinnati Fire Department has one, Cincinnati Police Department, Hamilton County Sheriff's Office, and then the Hamilton County Police Association followed up behind. So there's a bunch. Then we have the Tri-State Peer Support Team. So there's a bunch of teams in the area, and I think it all looks the same. So not anyone can do it, because you spoke of that empathetic portion of a person where it's like you definitely need to have that. There's the confidentiality piece that somebody needs to be able to keep, because you're not going to want somebody that just walks around and tells everybody's business. So that's an important part too. But basically you fill out an application after being kind of handpicked, you get vetted. And that could be through a list of questions, maybe a checklist of some promises you're going to make to the team. Your chief signs off on you. So making sure administration has some buy-in and understand of like what it takes to be a peer team member. And then there's a 2-day training that follows up with that. And in that 2-day training, it's kind of just a 16-hour course on various topics. We talk about traumatic incidents. We talk about debriefing. We have different therapists and counselors and other peers that speak, spouses of first responders, so they get the aspect of what first responders are dealing with and bringing home and how that's affecting the families. Some peers talk about their personal experiences if they're willing to open up and just talk about things that in their darkest moments, and then changing from the darkest moments, what helped them, and then how they're doing now, and then how they try and keep themselves up to a point where they're not falling back into that. So that's that 16-hour course. And there's an 8-hour advanced course that talks more about the critical incident responses that we do. So if some of the big ones like officer-involved shootings, bad accidents, that sort of thing, we go to departments or we talk to officers and meet them to make sure that they're doing okay, talk to the partners, talk to the bosses, that sort of thing, just to make sure that they don't need anything from a peer perspective. But essentially what peers do, because we're culturally competent in the work that we do, who else would know what somebody might be going through than somebody that might have gone through it themselves? So then you add that confidentiality component in there, so somebody doesn't feel like, police don't trust a lot of people just from our nature of business. So you add that confidentiality component in there, and it hopefully makes people feel comfortable. But I think just seeing other officers reaching out to peers and seeing that those interactions go great kind of gets people more comfortable. So that's kind of what it is. And then you have to be on a team. So you can't be a rogue peer support person. You have to be a part of a legitimate team, get vetted and signed off on and go through the training. Basically, myself as a coordinator, if a supervisor or a coworker calls and says that somebody they're working with might need some help, then I might fit them with a peer that went through the same stuff that they went through or similar. So like if James was going through something and I have never experienced that, well, it might be better to have somebody not to share their trauma with them, but just to know that they can go talk to James, and James might feel more comfortable because they went through the same thing. So that's something that we ask the peers that are interested to kind of share what they went through, why they want to be a peer, so we can help match them with people that need help.
How long have you been peer support specialist?
I'd probably say I started when I was at the sheriff's office. So that was a little after COVID started. I would say 2020, 21, maybe. And I worked with Allie Hovel, who was the coordinator there, and we helped develop that team. And then I left the sheriff's office, came to Montgomery in 22. And with all my experience there, that's how I got involved with the HCPA peer support team. And
we have several at the city, don't we?
Yep.
Peer support.
Yeah. Myself, we have Steve Hoy, Jeff Barger, and Becky Collegian.
And then I think I don't know if it's the same training. I would think so, but I feel like Ben Shapiro, our new fire chief, is maybe peer support.
Yes.
I don't know if it's the same program.
It's a 2 or 3 day. It could be the crisis intervention stress management training, but it's similar. So it kind of runs parallel. Okay. But we do work with the fire department also. So if I run across a fire, I've had calls where somebody's been on a call with a firefighter or a medic, and they're like, "Hey, can you check on him? Somebody's not doing too good." Or, "Hey, she just dealt with this. Can you make sure somebody talks to her?" Well, I know other, like at the Tri-State Peer Support Team or Cincinnati Fire, I'll call one of those peers and say, "Hey, I got a firefighter. Can you give them a call?" Because, police, fire, we kind of go through the same things, but they deal with different things. And so kind of a different culture, but all first responders, but I'll just get them in touch with somebody that knows what they're going through.
Yeah, because you guys are likely responding to the same call, right?
And
handling it differently, but
Right.
Like a shout out to Rasheed. And one of the things I think is really great is that in this region, how cooperatively you all work. The Hamilton County Police Association in Cincinnati and the Sheriff's Office and fire and police. I just think it's really great that everybody's looking out for each other.
I think we were very fortunate to get Rasheed from the county.
Yes.
Great officer. But he stood this program up. I mean, he did countless phone calls, meetings to get this up and running for the HCPA, because there's 44 or 45 agencies out there you have to coordinate with and get agreements signed and all that stuff, and then get your staff built up and trained up.
Right. So
it was invaluable getting him on board. This program wouldn't be where it's at today without him.
No, I agree.
I appreciate it. Stop.
Well, James, did you say you've been an officer for 20 years, or with the city as an officer?
I've been an officer and with the city. This is where I started.
Okay.
So for 20 years. And peer support back then looked probably like this. Hey, that was a messed up call. Let's go have a beer afterwards. That was, and you know what? For a lot of things that worked. But sometimes you would lean on that beer too much. And there's so many officers there coping with alcohol or drugs and to get through the mental health issues that they're dealing with. I've seen several friends leave the profession and have issues from dealing with what we see every day. And we're all affected by it. When I was 20 years ago, I thought I was, Superman, and I could see and deal with anything. But we all are affected, whether you realize it or not. So once you accept that, then you can start coping with it. Communication's key. And Rasheed he's not just a figurehead. He really walks us out. So recently, a few months ago, I lost my dad. And so I was going through that, trying to cope with that. Rasheed reached out to me several times, "Hey, how are you doing? What's going on?" And that meant so much to me. And it was like, he is the right man to lead this. And he didn't have to do that. I mean, we're friends, but he just continually connected with me and just let me talk and kind of vent a few times. And very appreciative of that. And that's really what we need to do, is just don't hold it all in. You know, you gotta let that out. You gotta let that stuff out. So
do you think that, and I'll just say within our department here at Montgomery, do you think there's a comfort level there that if somebody is really struggling, one, I feel like they know who to go to because we have so many peer support people within the department. Do you feel like there's a comfort level though that they would be like, okay, I'm struggling here. I need to talk to somebody.
Yeah, I think that's such an individual thing.
It is.
Yeah. And I think it's an individual thing. And I think, based on their experience and a lot of other, like I said, that stigmas, we're in a much better place than we were, but it's still very much, I think, as police officers, we are kind of that mindset, like, I spend all day solving other people's problems. I should be able to take care of my own problems. And
I would say there's definitely an increased comfort level with having 4 peers in a small department is huge.
Yeah.
I think we're probably the smallest department that has the most number of peers in one place that I know of, as far as an HCPA. So but also it depends on maybe what somebody's dealing with. But I say this before, like, we've been doing peer support for years before it was labeled that, but now it kind of gives us, I would say, more of like an accountability aspect where it's like, hey, we know we need to be doing this. So it just kind of makes people aware of, like, I see somebody's not the same as they were yesterday, or they changed after that call, or there was a bad crash, or they're dealing with something at home. They might be bringing it to work. So I think it definitely depends on the person, but whether they officially come to a peer or they come to a coworker, definitely I've seen an increased level.
Well, I'm glad that we have some resources now that we didn't have years ago, because, it kind of breaks my heart to think of things that officers have struggled with, that's had some major effect on their lives because it was part of their chosen career, and like James said, you start out young and you're going out there and you're going to save the world and you're going to do all this, and you don't sign up for all that it's going to do to you or to your family. Having this in place, I hope, affects the next generation so that people, one, want to keep going into law enforcement because we need it.
Right. Yeah.
And they need to know that there's a community there to support them to do this, because several years ago, all they're hearing is all the bad stuff that's going, they're making law enforcement out to be the bad people. And we know that's not true. So we want, I appreciate, Beth, so much what you do, because
thank you.
They need all of the officers need support, and they need to know that people are behind them. And that's what I feel like this is doing for them. So thank you, all 3 of you, for the hard work that you're doing, and for helping to hold each other up when you need it. Is there anything that anybody would like to add that we haven't touched on? Because this is not my world necessarily, so I don't want to leave something untouched that needs to be, pointed out.
I would say, so not just for police or first responders, but also for, like, just residents or people in the community. We're so quick to take care of a medical injury, or like a broken bone or a cut or something like that. But then when it comes to our mental status, like, we're not as quick to take care of that. So I just tell everybody out there that if you are feeling different, and you've been feeling different for, I would say, more than a week or 2, talk to somebody, go get checked out. If you don't know anything else other than maybe your medical provider, maybe ask them where you can get some resources. Call the city of Montgomery. You can get my number, James' number, or whatever, and ask us, and we'll figure it out. We were at the mental health fair a couple weeks ago, and Steve Hoy ran into somebody, and all of a sudden they're having a conversation for a while, and we got them hooked up with some therapy, and I got to double check on them to make sure, follow up to make sure that they're seeking that help. But it's just that sort of thing. So it's not just first responders, but everybody out there. So I would just say, if you're not feeling normal for a little bit, go get checked out and get some help.
Beth, for our listeners, for somebody who's just now hearing about Mental Health America, would you like to share, like, how they could reach out to you if they're interested in finding out how to get involved? Maybe we may, have a law enforcement officer that's listening to this right now. Who knows? So do you want to give some contact information or how they could find you?
So Mental Health America, our website, it's www.mhankyswoh.org. So that's Mental Health America of Northern Kentucky and Southwest Ohio, or mhankyswoh, as we like to call it. That's our website that has all of our free services on it. There's a crisis intervention tab for officers that has the learning opportunities to find out about our upcoming training. And if you aren't able to get to the website, you can call our office, and that number is 513-721-2910. Ask for me, Beth Roach.
Well, thank you, everyone, for spending time with me today. It's been very educational for me to learn about the CIT training, the peer support aspects, and just how, we're reacting with our community now. It's so much better than what it was, and I'm grateful to hear that. So thank you, listeners, for tuning in to another episode of Smashing the Stigma podcast. And until next time, be well.
Thank you for listening. If you or a loved one are in a crisis and need immediate help, call or text the Suicide and Crisis Lifeline at 988.